G'day guys and welcome back. Today's episode is all about health insurance. I have special agent Angela from Sura Healthcare, and she's going to be answering all the major questions about healthcare in terms of expat coverage, and also she's going to be covering some big updates for 2025. So let's get straight into it. Angela, first of all, can you give us a quick summary of who you are for anyone who hasn't seen our previous interviews together?
Thank you, Joel. My name is Angela Berrio. I'm an insurance agent, and I've been working as an insurance agent for Sura, representing the top company in Colombia for over 15 years, mainly working with expats.
Okay, brilliant. And can you just give us a quick summary of how many expats you've helped over your career here?
Oh my God, I could say more than 300.
Wow.
Yeah, a lot.
Amazing. And
A
one
lot.
of your most recent clients is me.
Correct.
Actually,
Correct.
yes. So I
Right.
was waiting for a long time to actually get my Colombian health insurance because I was waiting to get my cedula, visa, and all that stuff. So I just got that a few months ago. So Angela helped me to actually put that all together. And I am on one of the lower plans, which we'll talk about in a little bit. But Angela, can you give us a quick rundown of the health insurance and how someone can get it, first of all?
Anybody that wants to try out Colombia and wants to visit Medellin and is planning, or Medellin or any part of Colombia, who wants to stay in Colombia can apply for any of our health insurance plans, the three top tier plans with a passport. A lot of people don't know that you can start off with a passport, and as you get your visa, you get your cedula, then you can continue with your plan. I make it very easy. Client contacts me, I present a quote, different proposals, we discuss them briefly, and then determine which one better fits the client's needs.
Awesome. And if you want to get in touch with Angela to actually schedule a call and ask any questions about health insurance, then her contact number is in the description of this video. Just click that and you can WhatsApp her straight away. But Angela, let's go through those plans first of all. Can you tell us how they work, a rough guide to costs, because people want to know that as well, the top three plans that you can get with just your passport, no cedula, no visa required, please?
Okay, we have three top plans, just like Joel is mentioning. The three tier plans are Global, Clásico, and Evoluciona. If I were to compare with the US, these are like a Blue Cross Blue Shield PPO. They're VIP plans with a great phone book directory of providers where you have unlimited access to doctor's visits, no referrals are needed. The best is that there's no out-of-pocket deductibles, and you have me always to orient you to navigate the system, how to get your appointments, get lab work, diagnostics, etc.
For everybody wondering at home about the prices, can you give us a rough range? I know that it's very dependent on how old they are and things like that, but let's say for the middle plan that you have, what's a rough cost?
A rough cost per month can run between $90, or $150. Again, like you just mentioned, depending on the age bracket.
And that's complete coverage.
Complete coverage, hospitalization, private room in the best hospitals, intensive unit care, physical therapy. Again, like I said, doctor's visits, absolutely everything.
What would something like that, comparable healthcare, cost in, let's say, the US?
I've been here in already 15 years. I'm not such up to date as the cost right now in the US, but at least the out of pocket deductibles that my clients tell me they pay in the US is outrageous, $4,000. Here, you can access any diagnostic. You need an MRI, you need an electrocardiogram or colonoscopy. You pay 50,000 pesos for the copay, and you can do and have these exams as many times as you need to during your year policy. There's no limit.
Okay, so 50,000 is the deductible, I guess, the copay, and that's what, $15?
Nothing. Same thing to go to a doctor or a specialist or blood work. We even go to your home and do your blood work. We have home delivery. We have one dental cleaning per year.
These plans they can access with just a passport. What about the plans that they can access once they get a cedula and get a visa like I have now?
These are called Salud para Todos, and it's a lower tier. We have two plans, Preferencial y the normal one, the regular one. I think you have Preferencial, right, Joe?
Yes.
And how much is it costing you, like, per month?
Around $35.
And you have access to certain specialists. You also have access to some like blood work, some diagnostics. The difference between the higher tier plans that we mentioned from the beginning is that hospitalization is limited. It's in the hospitals that have to do with government insurance, and they can't guarantee that you will have a private room. It depends on how the hospital is at the time that you need a hospitalization, how full it is.
I just want to be completely honest with you. I don't know if you're going to like my answer or not. But I would actually say, to be completely honest to anyone watching, if you plan, or maybe a little bit older, and you plan to do a lot of exams, and maybe you have some underlying conditions that you might think need a lot of attention, these lower plans are not advisable. From my experience, I knew that I'm just have it as a safety blanket, right? Because, young and healthy, touch wood, I haven't really needed to use any health insurance that much. So I thought I'll buy this one, $35 a month, just use it if I need it, right? And a couple of times I had to book appointments, and it's been pretty clunky, to say the least. I've had to WhatsApp people. There's been a lot of back and forth. 3-4 months to get an appointment. The waiting time is a bit longer. So for anyone who really, really wants to be, get the full service, I would recommend getting one of the top plans, wouldn't you say?
These lower tier plans are made, like you said, young. You're looking at your cash flow. You're healthy, have good habits. You're not thinking of wanting something huge. The 3 top tier plans are amazing. You're not going to have any complaints. And the other thing is, Joel, come to me because I can help you get your appointments faster, or I can help you set up your appointments. And that's why I like to go the extra mile and help clients make it easier. Oh, and one thing I did forget, Joel, on the 2 top plans, which I said Global, Clásico, and then we have Evoluciona. Global and Clásico, once you have a cédula, you can access the travel portion that we offer for emergencies or accidents when you travel abroad from Colombia.
Next, I want to ask you about your recent trip to Turkey. You went out there. Sura had a gathering, I guess, for the best agents around the world, and they had some big updates for you. Can you explain that to us, please?
Yes, of course. Yeah, I won the convention. I was very happy and pleased and fortunate to be there. And then as soon as we came back, they invited the top health insurance agents to their backstage on how Sura handles our doctor at home emergency line. Say like an 800 number that you can call. You can call me if I'm available to help you out if you're in an emergency, anything minor. I mean, I'm coughing a lot. I have a huge fever. I don't know what to do. Or my stomach is hurting, or my I think it's a heart attack, God forbid. But they have special people that are trained to filter the conversation with our clients and know how huge the emergency is. And they'll send you a doctor at home with it's like an ambulance, but it's an equipped car with all that is necessary to save our client's life at home. We also offer this when you're in a hospitalization. You want to leave the hospital. You're not happy. Who's happy in a hospital? You're taken care of at home. Maybe you're sent home, you're released from the hospital, but you need to have some IV treatment, and they can do it at home. And they come every day or as many times as they need to. Sura sends a nurse to watch over you and keep this treatment for you until you end it. So it's a really, really nice service that we have. Again, emergencies, post-hospitalization, any type of treatment that you need, it could be handled from the home.
Awesome. That sounds amazing. So what other updates are there for 2025, Angela?
Okay, now in our top plan, which is Global, which has that huge coverage when you travel outside Colombia, up to a coverage of $1.5 million. Now they incorporated air ambulance in Colombian territory. Say, for example, you're an adventurer, you're hiking, you went to Santa Marta, to a small town in Colombia where there's not a lot of offer in hospitals, and it's an emergency, life-threatening. You're entitled to have the air ambulance service under our top plan Global. I just had a client who needed it for his daughter in San Andres. Other updates are now we've developed and we have a platform called Longevo, where you have access as our client under our plans for life coaching, for life videos on exercising, financial advice. You can also access virtual appointments with doctors, network within Sura and other clients. It's an amazing platform called Longevo. You can get nutritional access to appointments with a nutritionist. So it's more like the name says it, longevity.
And one interesting thing I want to talk about as well, because I've been booking a lot of these appointments. With the health insurance, I'm not sure if this works the same way in the US, because I never had health insurance. I don't know if you know, but in Australia, everything's free. So anything happens to you, free. So I've never had to deal with this before, but I just realized that it's not even for like doctors or if you're sick. You can actually book things for preventative care or even performance. So I'm an athlete. I want to be like peak fitness and stuff all the time. So I actually had a consult with a nutritionist I told her my goals and what I want to do with, playing tennis tournaments and stuff like that. Told her my current diet and gave her everything. And then she basically tweaked everything, told me what I'm missing, told me what I need to add, and basically gave me a full new diet plan. And people can use that as well if your goal is muscle building or fat loss or something like that. So it's not just if you're sick. Like if you're young and healthy but want to be healthier, take care of your health, going forward, you can also do that as well. Recently I also had a blood test, sent it to my doctor, and they told me all the little vitamins and stuff that I was missing and what to fill in to go to the next level of performance. I thought that was really cool because always in my head it was like, I'm not going to be sick, so I don't need health insurance. But it's not even about being sick, it's just about being awesome.
I loved what you just said because I make so much emphasis on my clients from the day one. I explain to all my clients, listen, don't think of the insurance not only as a check mark for your visa requirement. Think of it as an investment you're making. Healthcare in Colombia is amazing. It's top among the world. And you can use it for your preventive care. You can be, like you're saying, very healthy, great habits, blah, blah, blah. But once you go and get all your blood work, I love to do that every year. I do my blood work, check my vitamin D, my triglycerides, my cholesterol levels, etc. And that's like could be like a flag, a red flag. Oh, I need to watch this. Oh, I need to eat less sugar, etc. So it's very, from the preventive point of view, it's amazing.
Guys, if you want some more information or want to ask any questions at all, Angela's free to answer your questions. There's no charge at all for that. Click the link in the description. It'll take you to her WhatsApp number directly, and you can just get in contact with her straight away.